Defining primary amoebic meningoencephalitis. The word primary is first or foremost in development. The word amoebic means pertaining to an amoeba, and meningoencephalitis means inflammation in the brain or its surrounding tissues. When put together, this term means an amoeba first inflaming the brain and its surrounding tissues. Naegleria fowleri is the amoeba that causes PAM. It is named after Dr. Fowler, who in 1965 was one of the first people to discover the amoeba's ability to survive inside a human host or in the environment. As a thermophilic amoeba, it thrives in warm, fresh water. In order to cause PAM, it must enter through the nose, and it can survive temperatures exceeding 115 degrees Fahrenheit. The early symptoms of PAM usually present within 8 days of infection and include headache, fever, chills, and nausea. Later symptoms of PAM usually present 8 to 15 days after the infection and include parosmia, angustia, seizures, hallucinations, coma, and photophobia. The symptoms tend to mimic that of bacterial meningitis. Diagnosis of PAM. Tests to indicate PAM must focus on speed because of the rapid onset of the disease. 75% of patients are diagnosed at autopsy. Accurate patient history is important because the symptoms can be linked with the patient recently being in a warm, fresh water source. Polymerase chain reaction test is one of the quickest available tests and can spot the DNA of the amoeba in the cerebrospinal fluid. A visual test using cerebrospinal fluid is also an effective test and uses staining to isolate the amoeba. To increase the reliability of these two tests, the cerebrospinal fluid can be placed in a culture containing the bacteria the amoeba feed on to increase the number, then heated to a point where the only remaining amoeba will be thermophilic like Naegleria fowleri. Treatment of PAM. No known effective treatments, although some treatments have shown promise in recent times. Amphotericin B has been used in all 4 U.S. survivor cases, but is somewhat of a last resort due to its high toxicity. Miltefosine is an investigative breast cancer drug which has shown promise in recent years and was used in the cases of the 3 latest U.S. survivors. In 2013 and 2016, patients were induced into a therapeutic hypothermia, which is believed to have helped reduce brain swelling and damage. The risk factors for PAM are relatively unknown. Staying away from warm, fresh water sources is the only way to be completely safe. Wearing a nose clip while in lakes, ponds, and rivers is recommended if you do decide to swim. Young boys are most affected by PAM because they are most likely to splash, swim, and play in the sediment of warm, fresh water. The CDC does not recommend placing signs where Naegleria fowleri has been found because it could make people believe water without these signs is free of the amoeba. In conclusion, recent cases have shown that our ability to cure PAM has increased in the recent years. Naegleria fowleri is fairly abundant in nature, but PAM is very rare and hard to become infected with. Chances of PAM becoming a public health crisis are fairly low. Based on recent trends of recovery, we should have even more effective medicine and treatments in the upcoming years.